Show of hands, how many of you take your car to a mechanic when something goes wrong? You know, whether it's an oil change or there's something wrong with the tire pressure, or God forbid that check engine light goes on. Pretty much all of us, right? Yeah. And why do we take a car to the mechanic? Because A, we don't know what we're doing. B, we don't want to deal with the hassle. Here, just fix this thing. I don't have time for it. And C, because we trust the mechanic knows what he or she is doing, and we trust them to fix it and fix it right the first time. But then mainly because we trust these guys. Just like we trust our medical doctors, our pharmacists, hopefully our surgeons, will be coming out looking like this, and of course, our athletic trainers. Let's go back to these guys for a minute. We all said we would take our car to these guys because we trust them to fix our cars. But did you know these guys are licensed and certified for their position? I think most of us knew that, right? It takes up to 18 months to become an ASE licensed mechanic. Remember that word, licensed. Okay, with another show of hands, how many of you think these guys are healthcare providers? Not as many hands as there were when I asked the mechanic. Interesting, because they believe they are healthcare providers. In fact, this lady writes all about it. This is Amy Hyam. She has a law degree and a PhD in education and is the commissioner of the International Association of Continuing Education and Training. Sure, whatever that is. She wrote an article discussing how personal trainers belong in the same category as physicians, dentists, physical therapists, occupational therapists, and dietitians. The same category we belong in. And if they can't be placed into that category, she says they should be lumped in with physical therapist assistants, occupational therapist assistants, and massage therapists. She feels so deeply that exercise is beneficial to one's health, which I don't argue with, because we all know that exercise releases BDNF, a tropic factor associated with cognitive improvement and the alleviation of depression and anxiety, that they should be considered a healthcare provider. I don't know about you, but I want some of that Kool-Aid she's drinking. And here's why I disagree with her. Remember when I told you to remember that word? What was that word? License, right? What does it mean to be licensed? Here's what dictionary.com says license means. Formal permission from a governmental or other constituted authority to do something, as to carry on some business or profession. These guys are not licensed. I'm going to tell you why it's important to be licensed as a healthcare provider. In order to be licensed in healthcare, many specialists, like ourselves, complete numerous years of schooling, countless hours clinically, and pass a competency exam to test our knowledge. We all know what this is like. Some of us here have already gone through this, while many of us are going through this right now. It's terrible. But we grind through it, because this is what we want to do. To be a personal trainer, none of that is required. You simply need to be 18 years of age, have a high school diploma or GED, and be CPR AED certified, which we know holds no requirements to obtain, other than completing the coursework and paying for your money. So you're telling me these people can be personal trainers? These people have never worked out a day in their lives. I know, they're my former roommates. The only thing this guy lifts is 12-ounce cans to his lips, and the only thing this woman lifts is a TV remote and blanket to lay down on the couch and watch TV with this thing. But hey, I could teach them CPR in a few hours and they can go, and there you go. They're personal trainers. Just pay your $200, take this simple online test, and boom, it's that easy. Now, with all due respect to my former roommates, these two are some of the hardest working people I know. I wouldn't be who I am today without them. To work without a license as a healthcare provider can be dangerous and possibly very costly. If you were to cover a game or treat a patient in a rehab setting, and you were to cause further harm because you were negligent in your practice, you may be sued and fined and possibly spend some time in jail. Not something I would want to experience or have a family member or a friend experience. We put our trust in our caregivers. If they are not licensed, which for the most part means they didn't complete the proper requirements, they shouldn't be treating patients because it opens the risk of further injury to the patient. For a personal trainer, it can lead to having your client complete an exercise that they should not because they have an injury or pathology that you are unaware of or have no idea what it is. This is simply because they do not have the proper education and clinical experience needed to be working with clients or patients. Plain and simple. I mean, Think about this. Take a look at this picture. Pretty unrealistic, huh? Are you willing to try this? Probably not. Unless you're feeling a trip to the ER. Now, if you're in a former teacher's class right now, he would make me try this. He'd be like, come on, old man. If you can do this, I'll give the whole class an A on the next exam. Next thing you know, the whole class is trying to get me to do this. Chanting, come on, old man, you can do it. They don't care if I get hurt. They just want that A. These are some of the things you may encounter while working with someone who is unlicensed. But hey, they should be considered healthcare providers, right? Amy Hyam thinks so. But I have a hard time agreeing with this one. In America, it is required for all healthcare providers to be licensed to practice. Many states throughout the country have their own bylaws, but all require some type of license except the state of California, which to me is crazy. The so-called greatest state in the country has the least stringent laws. I guess that's typical for the free-living personalities out here, right? Whoa, surf's up, bro. That's all I have right now. I still need to add some more.